The cotton test evaluates which of the following structures: 1. Calcaneofibular ligament, 2. Lateral ulnar collateral ligament of the elbow, 3. Ligamentum flavum, 4. Deep deltoid ligament, and 5. Ankle syndesmosis. And the answer is ankle syndesmosis. What is cotton test? It is a manual stress test used to identify the amount of lateral translation of the talus within the ankle motis. The examiner stabilizes the proximal ankle while shifting the talus laterally. A positive test is marked by increased motion relative to the uninvolved side and is indicative of a sprain of the distal tibiofibular syndesmosis or the subtalar joint. A syndesmosis is defined as a fibrous joint in which two adjacent bones are linked by a strong membrane or ligaments. This definition also applies for the distal tibiofibular syndesmosis, which is a syndesmotic joint formed by two bones and four ligaments. The two bones are the distal tibia and fibula. The four ligaments are 1. The anterior inferior tibiofibular ligament, AITFL. Number 2. The posterior inferior tibiofibular ligament, PITFL. Number 3. The transverse tibiofibular ligament, TTFL. And number 4. The interosseous membrane, IOM. This picture or figure shows the syndesmosis joint anatomy. Okay. Ankle inferior tibiofibular ligament, AITFL, and posterior inferior tibiofibular ligament, PITFL, are the primary stabilizer of the ankle syndesmosis, limiting the motion of the distal fibula secondary to external rotation and 2 mm of displacement relative to the tibia during the physiological range of movement. Interosseous membrane, IOM, apart from stabilizing the syndesmosis, IOM also serves to transfer some of the axial compressive force from the tibia to the fibula during the weight-bearing activities. Widening of the ankle motis by 1 mm reduces the contact area of the tibiotalar joint by 42%. This would lead to instability and early osteoarthritis of the tibiotalar joint. Disruption of the intraosseous membrane, IOM, can increase the axial compressive force within the tibia up to 15%.